as knowledge has changed about HIV and how it's spread, it's become more evident that when people are newly infected, when they're freshly infected, their viral load, the amount of virus in their system becomes very great, and they're much more infectious than at later stages in the illness. Does that have any impact on the need to test?
Yes, indeed it does. We know that transmission of virus is much more likely from a person who has very high levels of virus in their system. So in early HIV infection, in an acute primary HIV infection, acute seroconversion, when levels of virus, if we measure them by viral load testing, can go into the millions of copies per mil of blood, the transmissibility of HIV in that setting is very, very high. And we see this from a lot of studies that have been done from all over the world. We know that if you were to test relatively early and find out that your HIV status, then measures could be taken to have more safe sex and reduce the amount of transmission from people who are more recently infected. I think that the issue of testing is very, very important these days, and people should know their status. There is a clear argument a decade or two ago where, because of limited availability of effective therapy, that people would have argued that, well, there was no point in knowing. I think in 2009 we have a situation where we have access to such excellent, efficacious and well-tolerated antiviral combination therapy that the reality is that treatment will probably give you a normal lifespan if treated at the appropriate time, and it would also seriously reduce the risk of transmission of virus from a public health perspective, because if you reduce the amount of virus as a whole in a community, then you're going to get less transmissions in that community. And so in time to come, I'm sure that with more treatment of patients, we'll see less transmissions of virus.
And just to put that into another perspective, when people are freshly infected, when they're newly infected, as Mervyn says, they have very high viral loads of several million copies. Once they're on treatment, those numbers reduce to undetectable levels, and currently undetectable is around less than 50 copies per mil. So there's a huge reduction in the amount of virus circulating in that person's system, making them vastly less infectious, probably not infectious.
That's very true.